Thank you. Let me make sure my map is open. Not Zoom maps. Okay. Oh, yeah, but I decided to get one of these. Yes. Pick one and come out. Oh, yes. Yes.
Okay, hope y'all are doing well today. Does everybody have the PowerPoint? Or is anybody that doesn't?
I don't have the PowerPoint.
Okay. Did you check in announcements or pages?
Yeah, I tried to use the link, but it didn't. Nothing popped up for me.
Okay. Yeah, how about the other two students? Okay. I can try to email it to you. Is this Iana?
Yep.
Means I hear you.
Mhm. All right. Well, I'll send it to you right after we finish because I don't want to mess up anything here. But today I just wanted to go over chapter 11 and 12. Thursday we'll do the final two chapters. And next Tuesday we'll have a review session. And the final exam will be next Thursday. Not this Thursday, but next Thursday. And it's going to be basically from these lectures that I've done. So if you know these PowerPoints well, you won't have any problem. And you can get some extra credit from the Cengage and Mind Tap exercises. Is that clear to everyone? Or anyone have any questions about that? It's kind of difficult with this virtual. I can't really tell how people are doing, but does anyone feel like they are having a problem or need some extra help or anything?
Me, I just got in. It's Natasia.
Okay.
The doc link that you sent earlier or last night, I still don't have access to those type of links.
Okay. Yeah, I don't. So what happens when you click them on?
It's just blank. Like it has the regular Microsoft dark blue, and then on the white part in the middle of the screen, it's just blank.
Are you using a laptop or desktop?
A laptop and an iPad.
Okay. Is anyone else having that same problem? Okay. Well, at the very minute, I'm not sure what to do, but we'll get it resolved. Have you gotten any of the lecture material?
The ones that show up on PowerPoint, like chapter 7 and the one about synapses.
Okay. And they came out good?
Yes, with using PowerPoint instead of the Microsoft Doc.
Okay, that doesn't work with the other ones, huh? Okay, well, we'll figure it out. But as for today, these are just some slides on emotion learning and memory, and also stress. Chapter 12, I didn't really get too deeply into it, and there's not really a whole lot to be tested on here. So whatever will be on the test will be from this information, and should be pretty straightforward. Emotions, what are emotions? Well, it's something we all have. We don't know exactly where they all originate. Sometimes a combination of different places in the brain. We do know about the limbic system, and that is a major component of emotions. And we know about the striatum and nucleus accumbens. Both of those are involved with the dopamine system, and they are associated with pleasure, but of course not the cause of pleasure. This is not the best slide in the world here, but it is just kind of showing how emotions involve the whole brain there, and are basically a response to whatever we are experiencing, seeing, or thinking about. And the thalamus, as you know, is an important component in being the traffic cop of the brain, and everything has to go through the thalamus before it gets to the cortex. And then the cortex sends it feedback and it distributes it to wherever it needs to go. Major players, of course, are the amygdala and hippocampus. So those are two things you want to know as much as you can about. The hippocampus is mainly a recorder that records everything that you do. And over time, it sends it to the cortex to be stored and retrieved at a later date. The amygdala is like the whistleblower, and it's always warning the rest of the brain if there's a dangerous situation or not. And it can really cause problems if it overreacts, because a person's constantly having anxiety and panic attacks and other problems associated with anxiety. So limbic system, you want to remember amygdala and hippocampus, and of course the thalamus. In evolution, human beings have an advantage over the rest of the animal kingdom because we have the cerebral cortex, which is where most of our intellect is believed to be from. A reptile, a lizard, or a snake does not have a cerebral cortex. They have basically just the brain stem and a little bit of limbic activity. So your pet, a cat or a dog, they function mainly on instinct. So they're not able to process higher thinking like planning and judgment and creation. Instincts basically occur in the limbic brain, and we do have a limbic system. The brainstem is basically for survival. So a animal low on the totem pole, like a lizard, for example, their main goal in life is just to live another day. And that's how their evolution has gone over time. And this is just illustration of the limbic system. Again, the thalamus, amygdala, hippocampus. There are other parts, but these are the major parts that you need to know and that you'll see a lot in the future at one place or another. This is just a slide of the brain that is illustrating those three major regions. What you want to remember again is the hippocampus records what's going on, the cortex stores it, and the thalamus has the job of keeping the rest of the brain alert and functioning so that it is able to focus and concentrate on whatever is going on at the time. Learning and memory involve coordination of a lot of different skills and tools. So just to be a college student, you have to master all of these things at any particular given time, and it's more than just remembering things. You learn how to learn in college, you learn how to manage time, study skills, take exams, take notes, communicate with instructors, and use the technology we have today to help learn. So you are in the best learning environment that there has ever been on Earth. So all the information you need is at your fingertips if you pursue it. This slide here is just illustrating the initial processing of memory and what really happens once you see something or think about something or experience something. Again, it goes to the thalamus, to the cortex, and the amygdala. And the amygdala is important, and it decides what's going to happen next. The hippocampus also receives the information and over time distributes it and makes sure it's stored for future use. As far as memory, there's basically a short-term memory that includes what you may have had for dinner last night or what you did 2 days ago. There's an intermediate memory that we use to test patients by giving them 3 objects to remember that are totally different and then asking them to recall the 3 objects about 5 minutes later. And that's a good test of the intermediate memory that hasn't gone to long-term memory yet. So the short-term memory is rehearsed in the mind until it's ready to be transferred to the long-term storage. Interestingly, the long-term memory is the last thing that a person loses. Even if they have severe Alzheimer's disease, they usually will remember things about their childhood or things that happened 60 years ago, but they can't remember who they're talking to or what they did 5 minutes ago. So the long-term memory is deeply rooted and usually doesn't leave a person during a lifetime. The laws of memory are basically through visualization or association. Most of the time we can remember things just as we see it, but you'll find out as you get older, your memory banks kind of fill up, and you have to master a skill called association, where if you can't remember one thing, you can remember something associated with it, and that brings it back to your memory. An example I gave there was, if, say, you can't remember who Mike Tyson is, but fortunately you remember boxing, and you can associate him with boxing, and then the memory of who he is comes back to you. Okay, the reason you keep seeing this so much is because it really is important to understand this principle here. So if you know this, you can figure out a lot of things that you may not know. Remember that the hippocampus records everything. The amygdala alarms the brain of danger or something that's not good for it. And the thalamus keeps the brain alert and focused. And all of those are part of that limbic system. So remember the limbic system. There are a couple of other parts that I'm going to bring into it, such as the nucleus accumbens, but it has more of a unique function, so I'm not mentioning it just yet. Most important thing to remember about the striatum is that it's part of the dopamine system. It has basically two functions. That's movement and function in the frontal lobes of organizing thought, and also in the hippocampus of memory. There is, of course, what's known as a declarative memory, which takes place directly in the hippocampus. And there is a procedural memory or muscle memory that takes place in the striatum. So you could technically remove the hippocampus, and a purpose patient wouldn't be able to form any new memories. They would just stay stuck at where they were when the hippocampus was removed. But the memory in the striatum would not be as affected, and therefore they could remember how to do things, such as draw a certain picture, or, of course, as I mentioned before, drive an automobile, or other things that you may not be able to describe in words all the time. But the striatum has its own memory system that's different from the rest of the brain. That is the point I'm trying to make there. And here we have the nucleus accumbens that is also closely associated with the limbic system, but it is a dopamine producing entity. And it's mostly important or responsible clinically in addictions. Anyone with a severe addiction, they will have a problem with depleting the brain of dopamine, because they use all of it and it's not able to be replaced naturally at a normal rate. Crack cocaine and crystal meth are the two most potent drugs that involve the nucleus accumbens. Crystal meth is pretty much the same in effect as the crack cocaine, except it's long acting, whereas cocaine only lasts a few hours. Crystal meth will last all day, and it wreaks havoc on the nucleus accumbens and the frontal cortex because all of the dopamine is used up. The hippocampus remembers the behaviors that it took to get the dopamine the last hit, and the brain therefore gets hijacked at the level of the hippocampus and the nucleus accumbens, and they basically use all the resources of the brain to just try and get more of the drug, and it eventually snowballs out of control. And that's why those addictions are so bad. I don't want to talk much about amnesia, but it is important to understand the two types of amnesia. The most commonly seen type is the anterograde amnesia, which is the inability to make new memories. And this would happen to a person if their hippocampus was removed or seriously injured. Retrograde amnesia is things that happen before the injury or whatever occurs, and it would include a person forgetting all the way back to childhood what had happened before in their life. This is less common, but it is something that is possible. So therefore, we need to understand what it is. I'm going to move on to stress in the body, but before I do that, I wanted to check and see if anybody had any questions or comments at this point. Stress is different in different cultures and for different sexes, but it's usually when a person is in a situation that they feel out of control of, and their body is constantly pummeled. Their nervous system is constantly stressed. And we all go through stress at one time or another. And our body is well equipped to handle short periods of stress, but it's not equipped to handle enduring periods of stress. We all have a survival instinct, and it's known as a fight or flight response. And it, in evolution, played a great role there by helping us to survive when we may not have survived. And basically, it's an activation of the sympathetic nervous system and the release of norepinephrine, both from the brain and from the adrenal glands. And it prepares the body to either fight to the end or to run away to safety, depending on what the best choice is at that particular time. But the body reaches a level where it could or can do things that sometimes maybe seem humanly impossible. There have been cases of people to like lift a car off of someone when they just have normal strength, but because their fight or flight had kicked in, they were able to do something that was extraordinary. Once again, the thalamus first receives a signal about the stress, and the amygdala signals the hypothalamus. Remember, the hypothalamus is the part of the brain that interacts with the endocrine system. So it has a close relationship with the pituitary gland. And once the pituitary gets involved, it secretes hormones, particular hormone that activates this particular axis. These are some of the symptoms you would see during the activation of your fight or flight response. And it's just getting the body ready to do whatever it has to do to survive. And this is an illustration that shows more clearly what's going on there with the hypothalamus. Virtually exactly the CRH is released by the hypothalamus, which tells the pituitary to release the ACTH hormone, and the ACTH hormone acts on the adrenal glands, which sit on top of the kidneys. And in long-term stress, a chemical known as cortisol is produced, and cortisol is the main stress hormone of the body, which early on has some benefits, but in the long term, if cortisol stays elevated too long, it causes all kind of organ failure and problems. The biggest problem with the fight and flight response is norepinephrine raises the blood pressure. And if your blood pressure stays up too long, sooner or later it's going to cause damage. And culturally, it's believed that one reason African Americans have such a problem with hypertension is because the stress that our ancestors have endured is that their fight or flight response had to be on constantly. Very rarely got a complete rest. And if it did, then the cortisol system kicked in, because cortisol stays elevated as long as you're in a situation that you feel out of control of and that you feel hopeless about. But that's going to affect different people different ways, just depending on what their circumstances might be. So how does this axis regulate itself and turn itself off? Well, when the stress goes away, it feeds back on itself and tells the hypothalamus and pituitary gland that we don't need any more cortisol because the stress is over. But when the stress does not end, the negative feedback loop does not work any longer. And eventually it will completely stop working if the stress does not end. Stress has major effects on health, heart disease, weight gain, sexual dysfunction, hair loss. All of those things can happen with prolonged stress. Or you may have noticed if you're the president, your hair will turn gray prematurely. And that's very well believed to be due to an unusual amount of stress on a day-to-day basis. But the main thing to remember here is that there's a short-term response to fight or flight, and there's a long-term response when stress is chronic, and that's the cortisol system. And in the past, they used to measure cortisol levels to determine depression levels and anxiety levels. They don't really do that anymore, but it's well understood that if a person is severely stressed, their cortisol will be much higher than normal. And this slide just shows some of the major problems associated with prolonged stress. Your immune system can really be dysfunctional. Heart attacks, strokes, ulcers, substance abuse, chronic pain, all of those are a result of stress. So it's often hard to treat a patient when you cannot control their environment. We have excellent medications, but medications alone are not a cure for most mental conditions. Medication and psychotherapy together are the best combination, but the problem that I see that's most disheartening is the environments that people live in. You can do an excellent job of patching them up and fixing them and getting them well, but if you send them right back to the same circumstances, the cycle tends to repeat itself. So I think that's one of the more frustrating things about practicing psychiatry. And many psychiatrists don't spend a lot of time in, say, impoverished situations or situations where there's a lot of despair. The job that most people want is one where you're treating more upper class people with just simple problems that probably going to get better even if they don't get treated. But that is just the world that we live in. We know that stress contributes to excessive morbidity and mortality, and that's because it affects almost every system of the body. And this is just some of the things that stress contributes to. There's quite a number there. And this is just a comparison of the fight and flight to the chronic stress management system. And if you learn basically this slide here, you know majority of basically what you need to know. Just have a good understanding of it. That short-term system ends in the fight or flight response, and it's mainly mediated by norepinephrine. And of course, the chronic system again results in elevated cortisol, which becomes toxic to the body at a certain period of time. Cortisol actually binds to the hippocampus and causes the hippocampus to shrink. It turns off neurogenesis, and the cells do not replace themselves after a period of time. And a victim can find themselves in a state of chronic depression and more prone to develop a condition known as post-traumatic stress disorder. So it's not just a psychological condition, but it's also a neurobiological condition where the physical composition of the brain actually changes and can reach a point of being irreversible or fatal. So that is the reason that stress management is crucial, perhaps the most crucial part of mental health treatment. And even though we understand that, we're not always able to implement it. But stress can affect everyone. We do know that getting enough exercise is crucial, getting enough sleep, having the proper diet. All of these things are just simple things, but you'll be amazed at how much it really doesn't happen. Chapter 12 was mainly talking about things that I don't think are most important for you to know at this point, unless you just want to read it and get the understanding of it. It's just the author's idea of intelligence and mechanisms of learning and different studies that have been performed. But I would like you to really know these slides here and understand, because that's stuff that you will carry with you throughout your rest of your career if you're in psychology or social work or anything that's serving the public there. If there are no questions, I'm going to do the final 2 chapters on Thursday. And as I said, we'll have a review next Tuesday, and we'll go over what to expect on the exam. And the exam is going to be kind of long, but it's going to be straightforward, simple, no tricks or anything. If you know the information, it'll come right out. Anyone have any questions?
I do. All the
Mhm.
other lectures was recorded, correct?
Most of them were. I think maybe the first 1 or 2 I didn't.
Okay, since I don't have access to those other other links, can I have the link to the recorded meetings?
Yeah, I'm gonna try to get all that for you.
Okay, that
Yeah,
might be better. The recordings.
yeah, I'll try to do that before the end. But yeah, I still don't understand why your links don't work.
I can email you a screenshot of what my laptop looked like when I go to those links, so you can understand what I'm saying.
Okay, yeah, because yeah, you really need this stuff to be prepared. But yeah, just send that to me. And if no one else has any questions or concerns, I'll see y'all on Thursday at 2. Okay, have a good afternoon.
You too.
Thank you.